Nobody wants to hear this one, but there are times that the epidural does not work. So what should you do if your epidural is not working? How often do they not work? And today we're going to explore all of that. I'm so glad that you're here because a lot of people don't even know that sometimes it can't work. So I think this is really important information for you to have. And of course, the epidural is not the only pain management option that we have in labor and delivery. I have a whole freebie about the different pain management options. I'm going to link it down below. So how do epidurals work? First off, as a nurse, I sort of think a lot of it is magic, but ultimately they're getting a needle into a tiny little space. One of my good anesthesiologist friends said it's kind of between the peel and the banana, if you're thinking of a banana analogy. They're getting the needle right into that little spot and they're injecting fluid that helps to numb those nerves that are below the area that they go into. Fun fact, your spinal column ends before the nerves that they're getting to. I know a lot of people worry that they could really hurt their spinal column, but it's just nerves down in that area, not the actual spinal column. So that's good for those of you that are concerned about that. So they inject medication, usually some pain medication and some numbing medication that just helps chill out those nerves. Most often, not very much of that even gets into your bloodstream. A lot of people will feel tired after the epidural, but ultimately I believe that is because they've had so much pain and they've been sort of freaking out inside and then they relax. And yes, it is a great time to take a nap. But what if that epidural is not working? As you can imagine, there are things that could go wrong in the whole, like finding the spot between the peel and the banana. And also they kind of thread a little tube down to that area to keep feeding it the medication. And there are things that can go wrong in that whole process. Lighting change. How long does it take for an epidural to work? That is a great question. I find most people it takes at least 20 minutes and can be closer to 40 minutes, kind of how your body reacts to the medication that they give you. So don't think that it's going to take effect right away. It takes a little bit of time. And we actually do a few things. We first off make sure that it's not in a blood vessel, and then we'll give you a larger amount, and then we'll do a continuous amount. So there's a few things that we're doing. A lot of people think it's in and going, when in reality, we're just making sure that it's in the right spot first off. So why wouldn't an epidural work? As you can imagine, it is a tricky job and it is not a perfect science, although anesthesiologists are very prepared to put in your epidural. The first one is that they just didn't get the right spot. Sometimes they think they're in the right spot and it's ultimately not the right spot. And in that case, they would need to redo it. Sometimes they can forget to give you the medication. So that's a good thing to check. Make sure that the nurse has turned the epidural pump on. We're all people and sometimes we forget doing things, especially if something happens in between our regular routine. So make sure that they're actually infusing the medication in case this has been a problem for you. And again, sometimes it just takes a while for things to set up. I'm a person where numbing doesn't take effect on me very quickly, but when it numbs real hard. Like same thing happens if I were to have dental surgery or stitches somewhere on my body. It just takes a while for me to numb up. So you might be that person and it might just take a little bit longer for you. So they'll want to watch it. And sometimes as you relax, your labor progresses very quickly. And I feel like the epidural just can't catch up with it. So if you were like 6 centimeters, you get an epidural, you start to relax and then your baby just like descends into that birth canal. Sometimes that pain cannot be caught up by the epidural. And so you can have a little bit more pain if you're progressing very quickly. And that can be measured, if your nurse goes to check you, they can be like, oh, turns out you're complete, and then we know that that is the reason. Now, as a nurse, very few of those things I can fix. I can make sure that we are running in the medication, and I can also check your cervix to make sure that that is not your issue. Most of those have to use the anesthesiologist to fix them. Now, what if you're pretty darn numb and then you just get one area that's very painful? And we call that a window. In my mind, I've decided that is from a tangle of nerves, of course, with this curly hair, a tangle of nerves where the numbing medication just can't get to that spot. Now, I've had patients who had the same window on every single birth. That's obviously an anatomical thing. And I've had patients who had a window on one and then didn't have a window on other ones. But sometimes there are going to be spots where we just can't numb it. However, they should be giving you more medication to just see if they can get to that spot. Sometimes it's just because you don't have as much medication as maybe you need. And if they gave you a little bit more, it would numb that spot. However, if you don't want to be as numb as you need to be, that may be a window that you just need to be able to tolerate. I know a lot of people are like, oh, all of this is a science, but a lot of this is an art. There is a lot of finesse and experience and just trying different things that we've seen work for other people to see if it will work for you. And if you're thinking, Hillary, I had no idea that I could still experience pain even if I had an epidural, I'm here to tell you that I actually recommend that everyone have some natural pain management techniques, both to manage the pain before they get the epidural, but also manage possible pain once they have the epidural. Because as we're going to talk through this, there might be some pain that you have even if you do have an epidural. So if you were thinking, oh, I don't need a birth class because I'm getting an epidural, first off, you totally need a birth class that explains how the epidural works and how to get the most out of it. But you also need one that gives you some natural pain management techniques. So if you're looking for one that talks about both of those things, I'll link the one that I recommend down below. There are a few side effects that catch people off guard about the epidural as well, and I have a whole video of that. I'm going to link that one down below as well. Now, here's a weird one. The epidural cannot always take away pressure. So as that baby descends into the pelvis, hopefully yours isn't crocheted, there's a lot of pressure on those tissues, and the epidural cannot always take away that pressure, which again is one of the reasons that I recommend that everyone get a birth class. As you can imagine, that pressure can be a lot. I know with my last baby, my baby descended kind of all at once, and I thought my baby was going to come out of my hip bone. I was like, I've never seen that, but I am pretty sure this little head is just going to come out right here, right on my hip bone. She didn't end up doing that, but it felt like that because of all of the pressure. My epidural was working, but it couldn't manage all of the pressure versus the pain. So when you think your epidural is not working, you have to differentiate between the pressure and the pain. And here's another fun fact that a lot of people don't know. We're not actually looking to entirely numb your body with an epidural. We're more looking to get you 80% comfortable with an epidural because we still want you to be able to move a little bit in bed, still feel a little bit of pressure, especially as the baby descends and you start to push. We don't want you to be like totally numb, lump on a log like we would if you were in surgery, which, fun fact, the epidural can be dosed up extra to do surgery. So it can entirely numb you if it needs to, but we don't want it to be doing that during labor. And another fun fact, you can actually raise and lower how much epidural medication you're getting. I love to do a hard epidural at the beginning so you get a good nap. That is the chef's kiss of an epidural, is the ability to get some rest when you are so tired. And then once they have their good rest and hopefully baby's coming down, we lower it a little bit so you can feel a little bit more, help us move a little bit more in bed. And I think people are ultimately happier. Some of you might be wondering if there is a walking epidural. Personally, most of that is a myth. I have a whole post about walking epidurals that I'm going to link to down below. And actually, this whole video is a post on my website. I will link that post down below as well. Now, the biggest question is, can't my nurse fix the epidural? And like I said before, most of the things with an epidural need to be done by your anesthesiologist. You are paying them a lot of money to manage this epidural, but I do see anesthesiologists from time to time, depending on the anesthesiologist, who are reticent to come back. They sort of blamed the nurse for whatever was going wrong with the epidural in the room. So if that is happening to you and you really want to see your anesthesiologist, which you deserve to see, they are charging you per hour for that epidural, say, I want you to call my anesthesiologist to this room immediately. Now, if they're in a C-section, you're going to have to wait. If they're in an epidural, but they should come in and see you at their earliest convenience so that they can help manage and fix this epidural. Even if it is pressure or just that's the 20%, they should come in and assess you. There are things they can do to check the level of your epidural. That's kind of how high or low on your body the epidural is working. They should be doing all of those things. That is their job that you are paying them for. So what can they do? There are some things that they can do. Of course, they may need to entirely replace it. So you need to know that if you were complaining about an epidural that's not working, you may need to get the whole thing replaced. Not a fun fact, but that is an important one to know. And it is something that they can do. They can pull out the one that's not working and try again. Other things they can do, they can pull it out a little bit. Sometimes the tube migrates kind of into a wonky spot or kinks a little bit. And so they'll pull the tube out just a little bit to see if that can help the medication flow a little bit better. Other things we can do is actually turn you because the epidural uses gravity. So a lot of times one side of your body will be really numb because you've been laying on that side. And so we'll turn you to the other side so that the medication can then run to that side. And movement during labor is still a really important part of when you have an epidural. And I would encourage you to make sure that you're still turning when you are not asleep. Okay, so what do you think through when you're still in pain and you have an epidural? First off, is this your 20% of pain? Did you get some relief from the epidural? Do you believe that the pain is about the same as you were when you started all of this? It should not be that, but you got to remember there should be some pain and pressure that you're feeling, but it should not be overwhelming. You are not looking to be entirely numb at this point. Maybe you're progressing very quickly. You could always ask your nurse to check you and see if that is the reason that you were feeling so much pain. Fun fact, I love to check people after I put in their Foley catheter. In case you didn't know, when you get an epidural, you also need a catheter that'll drain out the urine. I was always jealous of patients who got an epidural when I was pregnant because it is pretty darn nice to not have to use the restroom every 5 seconds. But when I'm putting in that Foley, it's a great time to check people's cervix and see if, they're dilating a lot or where we're at. And then again, take your nap. It could be pressure. Are you feeling it like overall? Is it a general thing or is it more sharp? These are things that your anesthesiologist should be assessing when they come in to check you out. And finally, make sure that you're talking with that anesthesiologist. It is annoying that sometimes they really have to be pressured to come back to a room when they are getting paid hourly for this job, but make sure that they're coming back in. I will say that I saw this a lot more at the beginning of my career, and newer anesthesiologists are very aware that their job is to actually manage this epidural and to make sure that you're feeling no pain. And of course, they're human. They want you to not feel pain during labor. So hopefully you get a great anesthesiologist, but I want you to be aware that there are some that kind of have to be pressured to come back in. Now, if you're like, Hillary, this is all really overwhelming, I think one of the best things to do is, can you lift your legs? So with a good solid epidural, especially right after we put it in that first hour or so, you should really not be able to lift your legs. If you're still able to move your legs, lift up your bottom like bridge pose in yoga, that's probably a sign that the epidural is not working so great and they really need to come back and fix it. Now, how often does this happen? I would say probably 20% of time patients aren't in love with how much they're feeling with the epidural. And I believe that a lot of these patients are not aware that they are going to feel something. This is not a time to be completely numb. But most of the time, patients are very happy with how the epidural works. And because you watched this video, you know how to get assistance in case this epidural is not working for you. I do find that managing all these different things and different doctors can be really troublesome. And so I do recommend that everyone get a good birth class that both teaches you about pain management and stuff like this, but also how to get what you need in the hospital because it is tricky. Again, I'll link the birth class that I recommend down below. Now, you might be thinking, Hillary, I want to know so much more about epidurals. I actually have a whole video about epidural frequently asked questions that I'm going to link to up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth.